Okay, some guests will continue to arrive. I extend a very sincere and warm welcome to everyone, Your Royal Highness, Excellencies, and esteemed guests. We know the importance of health for 114 million refugees, other forcibly displaced people, and stateless people. More people than ever are being displaced. And we know that climate affects health and disease patterns. This high-level event has two main objectives. One is for us to take stock of the progress that has been made in the implementation of health and MHPSS-related pledges since the first forum in 2019 and reflect on the best practices. And the second objective is to present multi-stakeholder pledges on health and MHPSS and provide opportunities to announce pledges to foster sustainable support for refugees and host communities. For me, this is also an opportunity to take stock of my own journey. This morning when I was traveling here, I had a moment of joy, humility, and pride to be coming and to be amongst you at this UN Global Refugee Forum. You know, I've been running away from bombs, from diseases and refugee camps for more than 20 years, looking somewhere safe that I could call home, somewhere to be accepted, somewhere I could heal my traumas, somewhere I could realize my childhood dream that one day I wanted to become a doctor, somewhere that I could contribute to the society so I could feel valued as a human being. I was born in Afghanistan in 1983 during the Afghan-Soviet conflict. Unlike so many other refugees, I spent my childhood hiding in cellars from the wars, from the bombs, from the rockets, from the jets. I have only two happy memories from the first 5 years. One was being taken to a local park by my mother to have an ice cream. And another one was when my father, he knelt down, he gave me a big kite before he disappeared from our lives. After 5 years, we traveled to Pakistan like millions of other refugees did. The normal borders were closed. We had to take a very dangerous route through mountains, valleys, and rivers, on donkeys and horses, until we made it. We had a very warm reception from Pakistani people. But unfortunately and sadly, the conditions in the refugee camps were inhumane. As a family of 8, we were living in a muddy room. That was an upgrade from a tent, surviving on the ration that were given to us by the UN Refugee Agency. Most of our family members suffered from malaria within days. And then within 3 months, I suffered from tuberculosis. My interaction with the doctor inspired me to become like him, to heal people. We went back to Afghanistan and spent nearly a decade in the civil war, again hiding in cellars from the bombs. Most of my education happened in those cellars with a lamp and whatever books I could find on the streets of Kabul, after hugging parents when there were too much noise of the bombs and shaking of the ground. I eventually made it to the UK on my own as a child refugee in 1999. And when I came to the UK, I also sadly brought PTSD along with the determination to do something with my life, and went on to study with the kindness of people at Cambridge University to ultimately graduate as a doctor in 2010. And that's when my trauma started healing, when I knew that I was a valuable person in the society. I could do something, I could help. I was accepted in the UK as a refugee, finally as a citizen, and went on to found a charity, Teleheal, which is a telemedicine charity that connects clinicians from NHS in the UK and across the world to clinicians in conflict zones, saving lives and changing lives like mine. And I've now founded Wellbeing, which provides high quality, trauma-informed and culturally appropriate mental health services digitally. Although your support is life-saving for millions of forcibly displaced people, let's remember that each one has a family, has dreams and contributions like I do. But it would not have been possible without the support that I received in a refugee camp, and further on, without the support that I received from countless other strangers along in my life journey. This high-level event has two panels. Each has a presentation by the panelist, followed by pledge announcement from the floor. The event does not follow UN protocol for speakers. The interpretation is available in French and English. Now, I would like to introduce our first esteemed moderator for this panel, Dr. Lara Suzanne Goulet-Sourghi. Dr. Lara Suzanne Goulet-Sourghi is the founder, executive director, and advocacy director at the Center for Migration, Gender and Justice. She is also an assistant professor of political science and global affairs at University of Portland. As a scholar practitioner and as a migrant woman, Dr. Goulet-Sourghi combines expertise in the field and lived experience in academic and policy work. Thank you.
Thank you very much, Dr. Wahid Arian, for the warm welcome to this important parallel high-level event on achieving health and well-being for all. And thank you to the group of Friends for Health, especially the two work streams on health and MHPSS, which I have had the pleasure to working with since June, for organizing the event and for bringing all of us together today. It is a true honor to moderate this first of two panels among such esteemed, high-ranking officials reflecting the multi-stakeholder nature of the pledges towards achieving health and well-being for all, including refugees, government representatives, international organizations, civil society, academia, and the private sector. In the first panel, we will focus on pledges as part of the multi-stakeholder pledge on achieving inclusion in national health systems. This involves support to national health systems to facilitate inclusion of all refugees, other forcibly displaced and stateless people through policy changes to advance on inclusion, supported by financial, material, and capacity strengthening, and to foster equitable access to quality health services for refugees and host communities in line with the principles of primary health care and universal health coverage and other health-related pledges. To begin, I would like to introduce our first panelist, Raouf Massou, UNHCR Assistant High Commissioner for Operations. Mr. Massou has worked in the field in many capacities for more than 30 years, including as Director of the Africa Bureau in 2019 and the UNHCR representative in Kenya. He has garnered expertise in various fields of UNHCR's activities, particularly in emergency response, repatriation, and the development of strategies aimed at bridging the gap between relief and development. Thank you for joining us. Mr. Massou, to help us set the stage for this panel, could you tell us about how inclusion in national health systems links with the Global Compact on Refugees? What has been the progress since the first Global Refugee Forum, and what are some challenges that remain as we charter the way forward?
Thank you very much, Dr. Goulet-Sourghi. But if you allow me, I would first like to really thank Dr. Wahid for his introduction. He's an extremely inspirational person, and it's when listening to people like you that we understand the meaning of the importance of the work we do and the responsibility that we have to provide protection and assistance to refugees. So really thank you for your testimony. Dr. Goulet-Sourghi, on your specific question, first, I would say that the first important point to make is, and is actually what we see in the Global Compact for Refugees, that inclusion of refugees in national services is more sustainable than establishing parallel systems. The second point is the fact that host communities must be supported. And healthcare is one of the sectors where these 2 points are most relevant, and the COVID pandemic response, during which it became obvious that no one would be safe until everyone is safe, was probably the best possible confirmation of the importance of inclusion. This is even more important today when we see more and more people displaced around the world, and global health challenges are increasing and becoming more complex as climate change impacts health, nutrition, and disease patterns. And through the GRF, what we aim at doing is to really move the needle on protection, inclusion, and solutions in refugee hosting countries, including through leveraging multi-stakeholder approaches that provide financial, material, and technical support that can help advance policy objectives of the host countries in a manner that helps balancing the scales. It's important to note that since the first GRF in 2019, multi-stakeholders have made 96 pledges to advance the health of refugees, of which 20% are already fulfilled. And this work has been moved forward by the Group of Friends of Health for Refugees and Host Communities, and I'm very pleased to be joined today by some of the group's leaders. Jointly, the group has developed 2 multi-stakeholder pledges on inclusion in national health systems and fostering mental health in psychosocial support. With immense gratitude, I am delighted to share with you that already 143 health and MHPSS pledges have been submitted, including pledges from 27 governments. Dear friends, this is, I would say, just the beginning of the work that we need to be doing jointly to uphold the right to health for everyone, working towards universal health coverage for refugees and host communities alike. Together, let's unite for their health and well-being. Your compassion can make a difference. Let's join hands with us today in extending a lifeline to those in need to ensure a healthier tomorrow for those forced to flee and for those who host them. Thank you.
Thank you, Mr. Masou, for these insightful reflections based on your extensive experience and expertise in the field. As you mentioned, while much has been achieved, notably in terms of the inclusion in national health systems, which is more sustainable than establishing parallel systems, and also addressing host communities, there remain challenges regarding the inclusion in national health systems, such as moving the needle on protection and balancing aspects with regards to this, that we must address as we head into this next phase in the implementation of the Global Compact on Refugees. With your initial assessment on important aspects in achieving health for all through the inclusion in national health systems, allow me to introduce our second panelist, Dr. Santino Severoni. Dr. Severoni is the Director of the Global Health and Migration Program at the WHO headquarters in Geneva. He is a medical doctor, health economist, and epidemiologist with systems management experience. He has over 24 years of experience as an international senior technical advisor and executive, and has worked for the WHO, governments, NGOs, and foundations in Eastern Africa, the Balkans, Central Asia, and Europe. It's great to have you on this panel and to connect with you in this context after myself having contributed and collaborated with you on the recently launched Global Research Agenda on Health, Migration, and Displacement. Speaking of which, Dr. Severoni, the 76th World Health Assembly adopted a resolution to extend the WHO Global Action Plan on promoting the health of refugees and migrants until 2030. Could you tell us about the opportunities this provides to foster the inclusion of refugees into national health systems?
Thank you, Lara, for the nice introduction. And my short answer to your question is that indeed is essential. The availability of the Global Action Plan and the extension has been playing a pivotal role in engaging health sector, Ministry of Health specifically, in building capacity, in investing into generating evidence, stronger evidence, better data, and getting close to the country in order to assist the change. We need to remind to ourselves that if we look at the past, the recent past, when we look at the management of refugee crisis or displacement, health have been brought into the picture always when there was a situation of concern, in a moment of emergency. The paradigm shift that happened with the Global Action Plan is that health became an essential, a fundamental element for people well-being, health and well-being, and not only refugees, because we need to, again, remind to ourselves that data of UNHCR, 85% more or less of the refugees, they're living into urban settings. So really accessing the same services or try to access the same services that the resident population, the host population has to use. So posing important element of integration, inclusion, but also equity with the resident population. The Global Action Plan has been really opening a new dimension in the health sector. And we have also noted that in 2019, when this was presented to our member states, there was a certain degree of skepticism, allow me to be very honest, because it was not clear for the health sector, for many colleagues in the health sector, what could be their own added value. At the extension last May, was overwhelming to see countries coming with very precise requests, very precise ambitions, very precise vision for the health sector to play in relation of inclusion and providing access to health for refugee and displaced population. Those changes, they're not only being shown during the discussion for the extension, but after May, on the way to come to the Global Refugee Forum, we had in Rabat, jointly with UNHCR, IOM, and the Ministry of Health of Morocco, the third global consultation, exactly to take stock of changes happening at country level. And again, this was the third consultation. We have seen a growing confidence, a growing ambition, a growing vision, strategic vision of member states. 50 countries that were present. There was a declaration which was adopted at the end of the consultation, which is exactly reaffirming the principle of the Global Action Plan in terms of inclusion of refugees, but not only. I like to also remind to all of us that when we designed the Global Action Plan, we really thought to aligning strongly with the global compacts, both the Global Compact for Refugees and the Global Compact on Migration. For us, this was essential because our intention was to bring refugees into the health debate, migrants into the health debate, which was not the case. Really, we saw an health sector without capacity, an health sector without data, an health sector without evidence. You alluded to the launch of the Global Research Agenda because we realized that really we were walking in the darkness in many aspects in terms of availability of evidence and research. The pledges of WHO of today on strengthening inclusion of refugees into the health system, promoting mental health, inclusion in humanitarian response, but also sexual and reproductive health and rights are, in my view, confirmation and driving forces for all these changes that we are observing at country level. Thank you.
Thank you for outlining these important opportunities for fostering the inclusion of refugees into national health systems as part of the WHO Global Action Plan. And your responses truly demonstrate the significance of multi-stakeholder approaches and interagency cooperation and collaboration, which was also emphasized by Mr. Moussou. Opportunities including strengthening engagement, building capacity, having better data, and the alignment with the work of of the WHO and the GCM and the GCR must be leveraged in achieving health for all. Expanding on this, may I introduce our next panelist, Excellency Dr. Messian. Dr. Messian is a seasoned medical professional specializing in health organizations and policies with a master's in public health from the National School of Public Health in Rabat and extensive experience in the refugee health concerns. Currently, he serves as the Secretary General at Morocco's Ministry of Health and Social Protection. Dr. Messian, the Kingdom of Morocco has taken on a leading role in the Group of Friends on Health and also hosted, as mentioned, the third global consultation on the health of refugees and migrants this year, which I had the honor of participating in. So thank you again. From a refugee hosting country perspective, what are the drivers to successful inclusion in national health systems, and what more needs to be done?
Merci beaucoup, Madame Lara. Si vous me permettez, je vais répondre en français. Votre Altesse, Excellence, la réussite de l'intégration des réfugiés dans le système ou de façon globale au Maroc et spécialement dans le système de santé est un challenge que le Maroc prend très au sérieux. Et pour le réussir, nous avons bâti notre stratégie sur un certain nombre d'atouts qui sont disponibles à notre portée. Premièrement, je dirais l'atout historique. Le Maroc a toujours été une terre d'asile et une terre de tolérance. Donc le deuxième atout, c'est un atout social. La société marocaine, comme vous le savez, possède une tradition ancestrale d'accueil et d'hospitalité avec une profondeur multiculturelle sous-jacente qui s'enrichit par la convergence d'un certain nombre de composants, que ce soit une composante arabo-islamique, une composante amazigh, une composante sahraoui hassani et plusieurs affluents, l'affluent africain, l'affluent andalou, l'affluent ibérique et judaïque et l'affluent méditerranéen. Donc, c'est des atouts qui sont disponibles et que nous avons bâti notre stratégie sur ça. Troisième point, très important aussi, c'est un atout juridique et politique de très haut niveau. La Constitution marocaine, dans son article 31, a insisté sur la primauté du droit international humanitaire et garantit l'égal accès aux soins de santé et la couverture sanitaire et la protection sociale de la solidarité. Quatrièmement, je dirais que le Maroc dispose déjà d'une stratégie nationale d'immigration et d'asile. C'est la première de la région MENA. Elle a été établie sur les hautes instructions de Sa Majesté le roi Mohamed VI, que Dieu l'assiste. Cette stratégie, elle cible l'intégration des réfugiés dans des secteurs clés comme l'éducation, l'emploi et l'accès aux soins dans les mêmes conditions que les citoyens marocains. Autre point, c'est le pacte mondial des réfugiés en 2018, notamment les points 2 et 3. Et je rappelle juste que le roi Mohamed VI, il a été déclaré et désigné champion d'Afrique dans le domaine, pour l'Union africaine, dans le domaine de la migration et de l'asile en 2018. Cinquième atout, c'est la présence d'une action et d'une participation associative et des ONG et une société civile très sensible à ce sujet de migration de façon globale et essentiellement pour l'asile et l'asile et les réfugiés. Et comme vous savez, le ministère de la Santé dispose d'une stratégie nationale dédiée aux migrants et que tous les migrants peuvent bénéficier d'un certain nombre de soins et de services gratuitement au même titre que les citoyens marocains. Et là, je parlerai de l'immunisation, de la santé maternelle, la planification familiale, la santé mentale, la santé scolaire, la prise en charge des femmes et aussi le volet lutte contre les violences. Je me contente de ça et peut-être après, je continuerai le reste de l'intervention. Merci à vous.
His Excellency, thank you. Your insights from the perspective of a refugee hosting country further shows the scope and impact that different stakeholders have when it comes to achieving health for all. As you noted, the historical context of Morocco in terms of asylum, the social asset of hospitality, multicultural aspects as the foundation, and then added to this, the political commitment of the government, the existing legal institutional frameworks, Article 31 with equal access to health and social protections, and then the development of the national asylum strategies and the alignment and implementation of the GCR, including also a very strong gender component. Thank you for this. Diving deeper into the multi-stakeholder expertise that this panel brings together, allow me to turn to Her Royal Highness Infanta Donna Cristina de Bourbon, Director of International Programs at La Caixa Foundation. Her Royal Highness oversees global health, humanitarian, and development programs in the most vulnerable countries in Africa, Asia, and Latin America, with over 690 projects in 65 countries implemented to date. She's also the president of the Board of Trustees of the Barcelona Institute of Global Health and interagency coordinator for the Aga Khan Trust for Culture. Her Royal Highness, thank you for joining us. We heard from earlier panelists about the successes, but also the challenges in achieving sustainable inclusion in national health systems. From your perspective, what role can the private sector play to support this undertaking?
Thank you very much, Lara. It is a great privilege for me to be here today, representing La Caixa Foundation. Allow me to begin by deeply thanking the government of Morocco, WHO, and UNHCR for that kind invitation to take part in this high-level event. For almost 120 years, La Caixa has been strongly committed to the progress of people and building a better and fairer society, giving opportunity to those who most need it. To carry out our mission, we foster quality partnerships and strong alliances, using efforts to face shared challenges. A clear example is our partnership with UNHCR, born back in 2002, with the aim of responding to the most important needs in refugee contexts. So as not to leave any refugee child behind, it is crucial to improve their nutritional status, indispensable starting point for their cognitive, physical, and socio-emotional development. And this is precisely why, since 2017, La Caixa Foundation has supported the MUM project in Ethiopia, with a contribution of 7 million euros to fund innovative solutions which tackle child malnutrition in refugee camps through innovation. And we do so acknowledging that the level of this challenge is difficult and needs the collaboration of all the stakeholders. The refugee population in Ethiopia has continued to grow in recent years. Conflict and insecurity, in addition to the effects of the climate change, are the main drivers of increased humanitarian needs. In this regard, it no longer makes sense to talk about health without talking about climate change. They both move hand in hand, and the most vulnerable ones are always the ones that suffer the consequences the most. In this difficult context, the MUM project has remained highly relevant to continue providing humanitarian assistance to prevent child mortality through methodological and technological innovation. We have supported the piloting of non-invasive technology for diagnosing anemia in coordination with the Ethiopian government and the leading technical and scientific partners such as the US Center for Disease Control and Prevention and the Johns Hopkins University. Since 2017, more than 1,250,000 people have been assisted by the MUM project, of which more than 800,000 are children under 5. I would like to take this opportunity to share with you that our commitment to fight against child malnutrition in collaboration with UNHCR will continue in 2024. Additionally, we also pledge to raise awareness about the health challenges for refugees through campaigns and other sensitization activities among our clients, employees, and all the Caixa Group stakeholders. Over the years, we have seen that the best results are achieved by joining forces. Working hand in hand with all of you will surely help to change lives and build better futures of the refugees and displaced population. Thank you very much.
Thank you, Her Royal Highness, for adding these insights from the private sector to our discussion. And the role that the private sector plays in achieving health for all is critical, as you mentioned, and the work done by you and the foundation, such as with regards to cognitive and emotional development, the MOM project as an example, as a project in Ethiopia in addressing child malnutrition and the collaboration that comes with it, but also understanding new and emerging trends such as the nexus between climate change, displacement, and health, and then piloting approaches through a multi-stakeholder approach, such as with Johns Hopkins University. And all of these really exemplify the role that the private sector can play in very important ways. Our next panelist adds to showcasing how different stakeholders are fundamental in achieving health for all. And it is my honor to welcome Dr. Zakira Hekmat from the Afghan Refugee Solidarity Association. Dr. Hekmat is an advocate for migrants and refugees with over 13 years of experience actively championing their rights and access to essential services. Born in Afghanistan, she later moved to Turkey, where she pursued a medical degree. Dr. Hekmat's dedication led her to establish the Afghan Refugee Solidarity Association, which she currently presides, focusing on enhancing the protection and social cohesion of refugees. In 2023, she received the International Women of Courage Award at the White House, recognizing her impactful contributions. Thank you for all you do and for being here today. Dr. Hekmat, as a successful leader of a non-governmental organization and a person who was a refugee herself, can you reflect on how civil society can support refugees in accessing national health services and how refugee participation can be strengthened across programs?
Thank you very much. Good afternoon, dear esteemed participant. I extend my heartfelt gratitude for the honor of addressing this distinguished gathering at the Second Global Refugee Forum. I stand before you today as a testament to the collective efforts aimed at achieving health and well-being for all, particularly focusing on the health system and mental health, also psychosocial support for refugees and host communities. I want to say that health is not just the absence of illness, but the state of complete physical, mental, and social well-being. In these critical times, where more people than ever are forcibly displaced, grappling with the complexities of global health challenges heightened by the COVID-19 pandemic, conflict in different countries, and exacerbated by climate change, our commitment to addressing the health needs for refugees is more crucial than ever. Our Afghan Refugee Solidarity Association, with its decade-long dedication to the welfare of refugees, has been at the forefront of supporting and advocating for the health and well-being of displaced communities. The challenges faced by refugees and refugees worldwide are diverse and demanding. Our experience in navigating this challenge has provided valuable insight into the multifaceted aspects of refugees' health. In many countries, the health landscape for refugees is a critical concern. While commendable efforts have been made by the third country's government, supported by the European countries' union to provide health services for refugees, especially for Syrian refugees, still non-Syrian refugees face also obstacles to access health care. This situation is not unique to one country. Refugees in my countries struggle to access health care overcome legal, financial, and cultural barriers. As we take stock of the progress made in pledge implementation and reflect on best practices, it's imperative to acknowledge the existing gaps and challenges in health services provision for refugees due to policies limitations or health system capacities. Also, in its commitment to the well-being of refugees, calls for sustained attention to the health needs of marginalized communities. It's our shared responsibility as stakeholders, policymakers, and advocates to ensure that health disparities are addressing comprehensively, leaving no one behind. In conclusion, let us remain steadfast in our commitment to achieving health and well-being for all. Our side stands ready to contribute, collaborate, and advocate for a world where the health and dignity for every refugee are upheld. Thank you for your attention, and I look forward to fruitful discussion and collaborative efforts in the days ahead. Thank you very much.
Dr. Hikmat, thank you for these comments on the role of civil society in supporting refugees and accessing national health services, and how collectively we can strengthen refugee participation across programs. Your tremendous leadership, deriving from your own lived experiences and expertise, offers insights on aspects including strengthening the well-being for all, psychosocial support for refugees and host communities, including also education and advocacy around this, and truly understanding the multifaceted aspects in health, and that policy frameworks must reflect this in a way of addressing health needs and challenges in a very comprehensive ways. And all of these aspects are fundamental to achieving health for all. Now, let me turn to our final panelist, Dr. Paul Spiegel, Director of the Center for Humanitarian Health and Professor of Practice in the Department of International Health at Johns Hopkins University. Dr. Spiegel is a Canadian physician and epidemiologist, and one of the few humanitarians in the world that both responds to and researches humanitarian emergencies and migration with a human rights focus. Dr. Spiegel has been leading the work to bring health together within the academia partners in the group of Friends on Health. He has been deployed on emergency mission, but kindly shared a recording with us on his perspective of the role that academia can play in fostering inclusion in health systems through research and educational activities. So please turn your attention to the video message of Dr. Paul Spiegel.
Distinguished ministers, ambassadors, and other government representatives, honored UN and NGO officials, and esteemed colleagues. I have the honor today to read an academic pledge for health as part of the multi-stakeholder pledge to the Global Refugee Forum. I am representing a growing network of academic organizations across the globe. We are, with resolute commitment, dedicating ourselves to the advancement of integrating refugees into existing health systems through robust research, evidence-based advocacy, and comprehensive educational initiatives. In doing so, we aim not only to uphold the fundamental right to health for refugees, but also to sow the seeds for their long-term resilience and well-being. This initiative is not just for the benefit of refugees, but also for the host communities that welcome them. Our vision is for a world where health systems are inclusive and strong enough to support the most vulnerable amongst us. Today, I'm proud to pledge the following over the next 4 years. At least 10 academic universities will, number one, dedicate resources for in-depth research projects with academic institutions from the Global South and the Global North that study the facilitators and barriers of refugee integration into national health systems. Number two, produce policy papers that offer evidence-based recommendations for integrating refugees into health systems in consultation with other stakeholders. Number three, cooperate with universities in refugee hosting countries to develop modules on refugee health and incorporate them in their training curricula for their health staff. And number four, offer scholarships for students who are or were previously refugees to specialize in public health And finally, number 5, jointly incorporate refugee health components into relevant conferences, bringing together academics, practitioners, and policymakers to discuss challenges and best practices. In conclusion, I extend my gratitude to each one of you for your presence here today and invite you to join us in our pledge. Your engagement is a powerful reminder of our shared humanity and the responsibilities that we carry together with refugees and host communities globally. Together, let us forge ahead, motivated by compassion, driven by knowledge and evidence, and united in our goal, creating a healthier, more equitable world for all. Thank you.
I thank Dr. Spiegel from afar for these insightful notes on the contributions that academia can make in fostering inclusion in health systems through research and educational activities, as well as for leading the Academia Pledge that will bring together, at this point, 10 universities with contributions in terms of research with regards to barriers and access to health, policy papers with consultations of other stakeholders, modules on training health officials, scholarships for those that have been displaced to study public health and to highlight health in international conferences. As someone who's also in academia and considers herself as a scholar practitioner, it has been a true pleasure learning from this. This now concludes the first part of the panel, so please join me in thanking our esteemed panelists for such insightful discussion on health for all with a focus on inclusion in national health systems. During the second half of the panel, we invite statements from the floor, including announcements of pledges with priority given to participants who already registered their interest to speak ahead of the meeting. This list includes, in order, the government of Egypt, the government of Armenia, the government of Iran, the UN Foundation, Sony Group, and Gavi. To all wishing to speak, kindly limit your interventions to a maximum of 2 minutes to allow more time for more partners to announce pledges. If time allows, I will then open up the floor again and will conclude the session with final remarks. Please note that if we cannot accommodate all speakers from the floor, interventions can also be made in the plenary session and or submitted in writing through the group of friends, and we will then add the statement to the brief report of this event. So I would like to welcome Mr. Shadi Hesham from the government of Egypt.
Your Royal Highness, is it working? Can you hear me? Your Royal Highness, Excellencies, esteemed panelists, colleagues, distinguished participants, ladies and gentlemen, I'm honored today to announce the pledge of Egypt, under the multi-stakeholder pledge on national health system inclusion. Egypt currently hosts around 430,000 refugees and asylum seekers registered under the UNHCR from 59 countries. In addition to more than 9 million migrants, the majority of which are coming from protracted situation and are considered refugee-like situation. Egypt has long adopted an out-of-camp policy, which allows the integration of migrants and refugees in their host communities and their inclusion in national healthcare and education systems on equal footing with the Egyptian citizens. And the healthcare sector in particular, inclusion of migrants and refugees in the Egyptian public health sector has been regulated through different ministerial decrees. Access to primary healthcare is universal for all migrants and refugees in the public health care facilities on par with Egyptians. Moreover, refugees are included in the secondary and tertiary healthcare systems. Refugees and asylum seekers are also included in nationwide health campaigns, such as the anti-polio campaign, the 100 Million Healthy Lives campaign against hepatitis C. Furthermore, according to the bylaw of the Universal Health Insurance Scheme, all foreigners residing in Egypt, including refugees, shall be covered by comprehensive health insurance. building on the previous pledges submitted by Egypt during the first GRF on enhancing the access of refugees to national education health systems, and with you to ensure and national policies rather than creating parallel systems for migrants. Egypt created the joint platform for migrants and refugees with cooperation with IOM and UNHCR to coordinate and streamline the provision of basic services to the millions of migrants. Under the joint platform, is proud to announce its pledge on enhancing the inclusion of refugees, and we look forward to the support of international partners to join to the platform, to our national pledge, in order to enhance the ability of the Egyptian government to enhance the scope and quality of the sustainable inclusion of migrants in the public services. Thank you.
Thank you to the government of Egypt for this pledge. Next, I would like to welcome the representative from the government of Armenia, if present. Okay, we will then move on to Dr. Ali Gol Mohammadi from the government of Iran.
Excellent. Thank you. Excellence, ladies and gentlemen, a variety of public health services are offered for refugees, such women and child care, including safe pregnancy service, surveillance of communicable disease, case detection, prevention, and treatment of TB, malaria, diarrhea, and acute respiratory disease, routine and supplement immunization campaign, school and student health, environment health, clinical service, neonatal screening for hypothyroidism and PKU, voluntary from refugees application, and as well as training of those for essential package of health service, prevention and control service for non-communicable disease, such as diabetes mellitus, hypertension, and cancer. All public health service PHC for refugees offered free of charge, just the same as Iranian citizens. Since 2019, three types of health posts for service delivery to refugees. One, health post inside settlement 30, health posts outside in a proxy of colony camp 41. Also very important, refugees has access to Iranian public health insurance over 150,000. Health expenses per capita for refugees estimated around $2.5 billion. We think that all human, all healthy. Thank you.
Thank you very much, Dr. Mohammadi, for this pledge from the government of Iran. Next, I would like to welcome Ms. Margaret MacDonald from the UN Foundation.
Hello? Yes. All right. My name is Margaret MacDonald, and I'm honored to represent the United Nations here at the Global Refugee Forum as part of the UN Foundation. I'm here to announce a joint commitment between United to Beat Malaria and Shot at Life, campaign focus on achieving organizations. Together, we have worked with UN agencies and partners to protect more than 100 million children around the world from preventable diseases. We're deeply concerned about the record level of displacement and specifically its impact on children's health. As a mother, I find it unjust and unacceptable that in the 21st century, parents have to worry about their children getting sick and dying from a mosquito bite and other preventable diseases. While significant progress has been made over the last 20 years, malaria currently kills a child every minute. And today, there are over 14 million children around the world who have not received a single vaccine. We know that displaced children are at increased risk for malaria, pneumonia, rotavirus, measles, and that conflict and climate change-driven displacement will threaten to further increase cases and deaths. For example, following historic floods, Pakistan had a 5-fold increase in malaria cases, and there was also significant increases in malaria in Nigeria, Ethiopia, and Uganda just last year. On a positive note, we have many effective tools in the fight against these diseases, to include bed nets, vaccines, and other innovations that are in the pipeline. And for the first time ever, the WHO has approved not 1, but 2 malaria vaccines that have the potential to save thousands of children's lives. Just last week, Cameroon received the first mass shipment of malaria vaccines following the pilot programs. That said, we know we cannot take for granted that refugees and displaced people will have access to these tools and quality health services, and we need to actively work to secure their fundamental right to health. So today, we're happy to announce that the UN Foundation Shot at Life and United to Beat Malaria campaigns are committing a minimum of $2 million over the next 2 years to ensure that refugee and displaced children have equitable access to all effective tools that protect against malaria and vaccine-preventable diseases. Further, we will work to advance the inclusion of displaced people in national immunization and malaria programs to make sure that they are not left behind. Our partnership will start with a focus on 4 countries, Uganda, South Sudan, Nigeria, and Ethiopia, and we will work in partnership with UNHCR, UNICEF, and other partners. We look forward to officially launching this initiative in April around World Malaria Day and World Immunization Week, and hope to increase our commitment and magnify our impact. So welcome collaboration and partnership. Thank you.
Thank you, Ms. McDonald from the UN Foundation for this commitment. Next, I would like to welcome Ms. Mitsu Shippey from the Sony Group Corporation.
Thank you. My name is Mitsu Shippey, and I'm honored to represent Sony Group Corporation. Sony's purpose is to fill the world with emotion through the power of creativity and technology. And we believe that in order to have people connected to each other with emotion, we need to create a society in which everyone can live with peace of mind in a healthy global environment. Since 2001, Sony has been providing support to UNHCR and forcibly displaced persons through financial and in-kind contributions, support to awareness raising, and other means. We recently signed a partnership with UNHCR to continue and expand our support in 2 key ways. First, provide financial support to improve access to health and WASH. Refugees are among the most vulnerable to infectious diseases and are more likely to suffer from poor health and nutrition. These vulnerabilities were only worsened by the COVID-19 crisis. Over the next 3 years, Sony is contributing $6 million from its Global Relief Fund for COVID-19 to help refugees access to health and clean and safe water, sanitation, and hygiene in Bangladesh and the Southern African region. Second, we will explore how our expertise and technology can support UNHCR amplify or scale up the impact, improve access to quality healthcare, and strengthen activities such as disease surveillance, early detection, and health response. We will also support efforts to raise awareness about the situation of forcibly displaced persons worldwide and help shape a positive narrative about these communities. Thank you.
Thank you, Ms. Shippey from the Sony Group Foundation Corporation, for this pledge. And next, I would like to welcome Mr. Tiago Luchesi from Gavi, the Vaccine Alliance.
Thank you so much for the opportunity. Dear Excellencies, distinguished delegates of the Global Refugee Forum, The number of refugees and displaced populations is continuously rising due to multiple challenges we are collectively facing, including the emergence of violent conflicts, the growing threat of climate change, extreme poverty, and multiple outbreaks. We therefore applaud the efforts of UNHCR and the group of Friends of Health led by the government of Morocco, sitting there on the panel, for putting health at the center stage and to include immunization as an essential service in this context. Gavi, the Vaccine Alliance, is a proud co-facilitator of the Vaccine Pledge alongside UNICEF and WHO, ensuring that everyone, regardless of their circumstances, can enjoy a life free from vaccine-preventable diseases. On this note, and in continuation of our partnership with UNHCR, Gavi, the Vaccine Alliance, has committed $220 million for 2022-2027 to ensure access to vaccines for populations living in fragile countries and or experiencing crisis and displacement, including refugees in and from the 61 Gavi supported countries. We encourage you all to mark this Global Refugee Forum with ambitious commitments that are measurable and transformational. Thank you very much.
Thank you, Mr. Luchesi from the Gavi, the Vaccine Alliance, for this pledge. I'm looking at the time, and it seems like we have a few minutes, 2 minutes each. Yes, if there are any further contributions for the floor, and if you could kindly introduce yourself as you're speaking. Yeah. Thank you.
Thank you very much. My name is Erika Velosa. I'm from Colombia. I am the director of an NGO that work with women, especially in psychosocial support, mental health in emergencies. So it's a pleasure to be here. Thank you so much for all your contributions and your very powerful speech. I would say that one of the things that we see on the field is the impact of the emergencies, humanitarian situations, and refugee situations have in the people, in their emotions, in their psychological approach to the life, and even in the mental health. And sometimes what we see is all the efforts are very focused in the first action of the responses, no? And all the clusters related with the survivors and the way that they can integrate themselves into the society. But that is not possible without a very strong support in that field. And I would like to know if related with that approach, the approach of mental health and psychosocial support, there is a big commitment about all these processes related with particularly women, girls, and boys. That is the people that we work. And if you are working with Latin America in that sense, because maybe that is the lack that we could see in the humanitarian action that we face related with armed conflict and migration that we have in a very powerful situation. And just for information, we have the third maybe immigration in the world, but it's the first one related with women and girls in the world too. So it's interesting to see that because the risk that they face. Thank you.
Thank you very much for this contribution. I think actually panel 2 will address this in more detail. So thanks for being here, and I hope that you can stick around for this second part of the panel where this will be addressed. Please go ahead if you could introduce yourself. That would be great.
Good evening, everyone. My name is Mohammed Al-Hajali. I'm academic clinician from the UK and also leading an organization which looks after refugees. I would like to thank all those who pledged, really. I mean, looking at like financial causes for the distress comes always when we talk about like the health. We need definitely inclusion in the health system and all that stuff. That's definitely beautiful pledges. But what I would like to draw your attention here, it's about like the human being factor here in this story. When we talk about refugees, we have many doctors, healthcare professionals in areas and conflict zones and war zones. These people really play a major role in helping refugees. They are among that community. They are refugees themselves or forcibly displaced, and they do a major role. When we look at Syrian refugees, for example, healthcare professionals in northwest Syria, these people who did like a hero job, and they're being really very much affected and impacted with like the bombardments happen to their like facilities, or like the hostilities, for example, attacked the hospitals and also their mental health themselves. I mean, we look at like very difficult story and very traumatic stories as well. So I would like in the future to have or to see a pledge, hopefully one day, that hospital is not a target, facility is not a target. Healthcare professionals themselves should be protected in any conflict zone in the world, regardless of their background. They should be protected. They do a heroic job. And we definitely need to think about like a human-centered approach, not only thinking about like the budget and the financial reasons. That's definitely important. We would like to include them in these health systems, but also we have to look after the human element, the human factor in the story, which is, in my opinion, very, very important. From loads of stories I got from Syrian healthcare professionals and others in the world as well. Thank you.
Thank you for this very important point. And I would just again just like to point to the tremendous leadership that we've seen by Dr. Aryan, by Dr. Hikmat as examples when it comes to this. So thank you for this contribution. I think we have time for one more contribution intervention from the floor. And please introduce yourself.
Yeah, hi. Can I ask a question? Okay, thank you. Hi, my name's Sonia. I am a student journalist. I'm from the student delegate. I just graduated in journalism, and I'm currently working at Screenshot Media. That's a social media-based news agency for Gen Z in London. So a couple of days ago in the UK, on board the BP Stockholm vessel, which is housing refugees and asylum seekers who have arrived in the UK, we saw there was a death of an asylum seeker, and the apparent cause of death was a suicide. And it's been linked to very poor conditions inside this vessel that was holding 500 asylum seekers. And a few months ago, there was also an outbreak of bacteria and it had to be evacuated. So, you know, evidence of quite bad conditions. Following this suicide, do you think that the UK government should be taking accountability for it? And also, my second question is, what can countries do? Oh, sorry. Oh, to look at people, did you say? Okay, in that case, what I just said about should the UK government be taking responsibility for that suicide given the poor conditions of the vessel?
Thank you so much. Perhaps could I ask Mr. Rauf to give his thoughts about this? Thank you, Rauf. Sorry for putting you on the spot.
No, I think it's actually a very easy question. Right of asylum. Anybody has the right to seek asylum. And all governments have a responsibility to allow people to seek asylum. It's very clear. It's international law, and everybody knows. Politics can change things, but the reality of international law is the responsibility of the government to allow people to seek asylum. Thank you.
Thank you, Mr. Masu, for taking on this question with a very direct answer. And thank you for all these contributions from the floor. And again, if anyone else would like to make any interventions later on, there is space in the plenary session and or can be submitted in writing through the group of friends on health. And we will then add that statement to the brief report for this event. And so now allow me just to briefly conclude with a few remarks. This panel has made it clear that addressing the health of refugees, other forcibly displaced and stateless people has never been so important, and that this necessitates a multi-stakeholder approach with intersectoral coordination, information sharing, and programming. Today, we were reminded of the important contributions that different stakeholders make in achieving health for all, whether it is intergovernmental organizations, government agencies, the private sector, civil society, academia, and those affected, namely refugees, other forcibly displaced, and stateless people. While much has been achieved since the last Global Refugee Forum, much lies ahead of us, and I truly believe that is collectively that we can achieve health for all. Our panelists have demonstrated this with their experience and expertise, and the group of Friends on Health, as organizers, provides a platform to do so. And so with this, I thank the panelists, the organizers, and all of you for joining us for this first panel. There is a second one. And so I will pass the mic back to the Master of Ceremony, Dr. Ariane. Thank you very much.
Okay. I'm supposed to be a digital health expert, so that proves it all. Expertise alone is not enough. So we need to work together. Thank you, Dr. Santino. I sincerely thank my esteemed guests in the panel, the leadership, Your Highness, Royal Highness, Your Excellency, Dr. Gulasorhi, and the leadership of UNHCR, leadership of WHO, for your kind contributions. So if you would like to get seated, and we will invite the second panel to come to the stage now. Thank you. Please clap one more time for the contributions of the first panel. Thank you. So lovely to meet you. Let's do it. Yeah. Amazing. Yes.
Hearing my name.
Yes, sure. Yeah, okay. May I ask everyone to get seated, please, so we can stay on time and we can hear from our esteemed experts and guests. We're going to start very shortly. So whilst you're seating, we heard about the importance of health of refugees, of the various factors that affect their health, of the barriers, and how to overcome those barriers from our expert panel early on. Now, the second panel will discuss the crucial role of mental health and psychosocial support. This is again a topic that's very close to me personally. Early on in my journey, I mentioned how I faced malaria, tuberculosis during my time in refugee camps, and for my family members. When I talk about myself, I hope I can represent more than 100 million forcibly displaced people. Unfortunately, they can't all be with us here, so I hope I can echo their journeys through my personal story, and that's why I like telling stories, so we can visualize the importance of the work that we all do here, which should be above numbers, which should be above any written words. My personal interaction with mental health started when I was 10. I first had depressive symptoms during the civil war in Afghanistan, when I couldn't make sense of what was going on. For the first time, I was questioning life. On one hand, I would hear on radio that people would go for dinner, people would go to school, some people would go on to talk about washing their dogs. And I didn't have even water, clean water to drink. And that's when it hit me that my life was very different. And the second time, and at that time, I so wished that I had somebody who would pat on my shoulder to give me a hug, to tell me that things would be okay. I so needed that psychosocial support, which I didn't have. And the second time was when I came to the UK age 15. Although I was so happy that I was safe finally, I was determined to use every opportunity. But post-traumatic stress symptoms didn't leave me. A bus on the streets of London would turn. It was a red bus. It would turn into a tank in front of me. In the middle of the night, I would have nightmares of a sniper taking my head off. And most of the time, my fists would be so tight, I couldn't even stand in front of 4 people in the class of a college to talk. So it's a miracle for me to be standing in front of you, to be talking to you. At university, I was socially isolated. I was at one of the best universities in the world, Cambridge. So I was so happy, but I was most of the time locked away in my room because I didn't know how to integrate. I thought I would be discriminated. And those symptoms went on for more than a decade until I sought specialist services, which didn't exist. And that brings me to the importance of highlighting the mental health and psychosocial support for all refugees and forcibly displaced people. And that's the reason why I founded Arian Wellbeing, to provide trauma-informed and culturally appropriate mental health services for everyone, including hard-to-reach populations like refugees. So mental health needs of forcibly displaced people are elevated because of what happens to them in the country of origin, because of the journeys they take, and finally, the numerous challenges they face when they arrive somewhere safe. So we need to attend to their needs if we are able to allow them to restart their lives so they can pursue their dreams and contribute to society like I have and so many others have. Our expert and esteemed guest in the next panel will discuss all this. I'm introducing the moderator, Danielle De La Fuente, who will be leading this expertise panel. Danielle De La Fuente's passion for peace building stems from working at embassies and the US Department of Defense. She founded Amal Alliance, an NGO that provides displaced and marginalized children worldwide with social development programs that help children cope with the adverse experiences while providing the learning fundamentals needed to succeed. Before I hand over to Danielle, I just would like to announce that all member states and organizations who submitted a pledge related to health or MHPSS are invited to attend a photo opportunity today at 1800 in Palexpo outside the media room 3, and that is up the ramp from the main plenary room. Thank you, Daniel.
Thank you. Good afternoon, distinguished guests. Welcome to the next segment of our event. First and foremost, thank you to the group of friends, the MHPSS workstream, and organizers for allowing to shine light on the importance of mental health and psychosocial support. This panel will focus on the integration of mental health and psychosocial support within health, education, and protection, transcending traditional sectoral boundaries across the humanitarian, developmental, peace-building nexus, specifically through policy changes towards inclusion that are supported by financial, material, and capacity strengthening to foster access to quality services and support for refugees and host communities. We have a wonderful panel of diverse speakers, which reflects the true nature of the multi-stakeholder pledge that includes refugees, government representatives, international organizations, civil society, and the private sector. We have the honor to start with our first panelist, Parliamentary Secretary of State, Mr. Niels Ahnen from Germany, who serves under Germany's Federal Ministry for Economic Cooperation and Development. He was Minister of State in the Federal Foreign Service and served as a member of the German Foreign Affairs Committee. It is a pleasure to have you here with us today. Parliamentary Secretary of State. Germany has been a major champion of MHPSS within development work. Your government has also been spearheading the joint pledge on MHPSS together with the Netherlands and the European Commission that has drawn in other member states, UN agencies, and NGOs. Could you please introduce the pledge and describe how it intersects with humanitarian development and peace-building programs?
Daniel, thank you so much, Royal Highness, dear colleagues, dear friends. Our health, I think that's the key. It's not, and we just heard that, I think, in a very impressive way. It's not just about our body, it's also about our mind and soul. And when it comes to physical injuries or illnesses, people see the need and urgency to treat them. But in many societies, mental health is either a taboo or topic, or it is seen as less important. And that's also true for our societies. Yet mental health and well-being are key for coping with crises for political, economic, and social participation. In addition, in a context of displacement, women and girls are also often faced with gender-based violence. While physical injury is often, of course, visible, in many cases, psychological injury is not given enough attention. Yet mental health and well-being are no less crucial. They are an important condition for people to overcome crises, participate in society, and build trust in their community. And that is why I am welcome very much that mental health and psychosocial support, MHPSS for short, is on the main agenda of the Global Refugee Forum for the first time for this year. And that is why, together with the European Commission, as you mentioned, the Netherlands, and 13 other partners, which we are very grateful, we have committed to strengthen psychosocial support for displaced persons. Together, we pledge to raise awareness for the importance of MHPSS in the context of displacement. Even more importantly, ladies and gentlemen, we pledge to mainstream high-quality MHPSS measures in our work. This applies to development cooperation, it applies to humanitarian assistance and peace building. Such as a holistic approach is exactly what is needed to ensure our engagement has a lasting impact. For us, two things are of vital importance to ensure that our joint pledge is going to be successful. Firstly, we believe that quality psychosocial support begins with trust. That is why community-based services and initiatives, which are driven by refugees, are so important in that case. They know best what displaced people need. Secondly, national health systems need to be strengthened so that both refugees and local people in host communities can benefit equally from psychosocial support in the long run. So, ladies and gentlemen, I invite you to also join the multi-stakeholder pledge so that we can jointly strengthen psychosocial support for displaced people. Thank you very much, and thank you very much for giving me the opportunity to address this audience here.
Thank you so much, Parliamentarian Secretary of State, and thank you for Germany's leadership in the joint multi-stakeholder pledge fostering MHPSS. I also want to thank you for bringing up the notion of trust. That's so critical, especially when we're working with community-led organizations, and which actually is a very nice segue to our next panelist, who is running a community-led, refugee-led organization, David Carrero, who himself is a refugee and the founder of the Burundian Youth for a Brighter Future an organization intervening in mental health and psychosocial support in emergency settings in 7 countries. He is the recipient of the 2020 World Dignity Project Mental Health Champion Award and has been recognized locally and internationally for his efforts in mental health equity. David, welcome. As you fled from Burundi to Denmark, and you use your remarkable experience to help refugees globally, and particularly in Africa, could you explain why it is so important to systematically and meaningfully engage with refugee-led organizations, not only on the ground, but also in forums such as this one?
Thank you. Good afternoon, dear guests. Allow me first to thank you all for having me here. Refugee-led organization plays an important key role in finding lasting solutions. In our organization, Burundian Youth for a Brighter Future, an organization led by refugees for refugees with refugees, we work on finding a lasting solution through self-resilience in meeting our own essential needs. We do so through preventive care, in capacity building of refugee and empowerment through a regular training. We also make some skill acquisition lab. We also use sports and other activities and entertainment to help to reduce some trauma that refugees may have. We also have another immediate care where we do some peer-to-peer counseling, also make use of existing skills and health workforce within camps. And it's really important because it has proven that most refugees feel comfortable while talking to fellow refugees rather than talk to some mental health specialists or social workers. Yeah. Giving some recommendation, we as refugees, we need you global leaders and international organization, of course, to meaningfully engage us as we are expecting our own experience in knowing how to effectively navigate the resources and challenge with our daily living unique context. We also need a new paradigm shift on how we are engaged and how government and institutions make best use of our knowledge, because we have a lot of expertise to share, but we feel like we are not meaningfully engaged. We also ask for capacity building to train refugees, because we are on the front line of emergencies 24 hours, 7 days. So I think if we are trained, we will be able to help and respond better to mental health, psychosocial issues in our communities. It will also contribute to close the gap between the informal, like lived experience, and formal. I mean scientific, because we have a lot of academia here, and ensuring finding lasting a solution. I will end in thanking the previous panelist on how he said that their governments make quality psychosocial support, that these quality psychosocial supports always begin with trust. So we are asking you, global leaders, also institutions, to trust us, also to tell you that we are ready to contribute. Please support us to doing this. Engage all refugees in your program. We are here to contribute Thank you, everyone.
Thank you, David, and we hear you. We're ready to contribute. And I think one thing that you noticed, you mentioned, it's not just engaging with refugee-led organizations, but really meaningfully engaging and making sure that you're leveraging the human capital, the skills, and the knowledge, even peer-to-peer support to really make the programs more sustainable and lasting. So when we're speaking of locally led efforts, they contribute to the global system. So let's shift perspectives here and introduce our next panelist. Mr. Ted Shaiban was recently appointed by UN Secretary General as Assistant Secretary General of the UN and serves as Deputy Executive Director for Humanitarian Action and Supply Operations at UNICEF. Previously, Mr. Shaiban held several positions at UNICEF, including Regional Director for the Middle East and North Africa, and worked with Catholic Relief Services in several countries. Mr. Shaiban, welcome.
Thank you.
UNICEF has committed to scaling up evidence-based community health, mental health, and psychosocial interventions with and for children and families across sectors. Could you sketch UNICEF's vision and its plan of action?
Thank you, Danielle. Let me start by a couple of thank yous. Actually, I would first like to appreciate the leadership of Germany, the Netherlands, and ECHO in pulling together the MHPSS mega pledge. And I also would like to thank Wahid for sharing with us his personal experience. I grew up in Lebanon during a time of civil war. I'm a bit older than you, and in the 70s, I left Lebanon as a 15-year-old and found myself in the U.S. with those same feeling of isolation, those same feeling of depression. And I wish at the time I had known what it was. And I think it just highlights, I think, the importance of mental health and the importance of supporting children on the move, refugee children with issues related to mental health. So what does UNICEF pledge to do about it? I think what we pledge to do about it is to work through supporting countries hosting refugees so that their national systems take mental health into account, both for their own children, but also for refugee children. And specifically, we pledge to do so through two major platforms. Firstly is education and the education system. And there we have an initiative called the Building Lifelong Opportunities for Mental Health, or Bloom initiative, which we do with WHO, which helps non-specialists reach out to 5 to 10-year-old and their caregivers, identify any kind of struggles that they have and address those mental health issues. And we'd like to roll this out in the following countries that are hosting large refugee populations: Lebanon, Jordan, Colombia, Iraq, Uganda, and the DRC. That's our first pledge. I have to also say that we're all seized by what's happening in the state of Palestine right now. And one of the key issues that we're trying to address as we speak is the mental health of Palestinian children that have been internally displaced within the Gaza Strip. And that's going to be a key issue that we'll need to take care of going forward. The second major system that I think we'd like to see take this on, and I think when we think of primary healthcare, we all think of a system that primarily deals with immunization, that deals with children, 0 to 5, maybe their mothers. That's not primary healthcare in the 21st century. Primary healthcare in the 21st century deals with community as a whole. And we've seen primary healthcare systems in places like Algeria and places like Tanzania with a very strong mental health component. UNICEF, working with a range of health agencies, WHO, Gavi was here just a minute ago, the Global Fund is committed to seeing mental health as a key primary healthcare intervention. We're saying coming out of COVID that we need to invest in primary healthcare and support to community health workers, frontline community health workers. And part of that is to incorporate work for their own mental health, but so they can also provide mental health services to communities. And again, in the spirit of this GRF overall, do so in an inclusive way so that it also includes refugees and internally displaced children and their families living in those communities. So those are our two pledges. Thank you.
Thank you, Mr. Shaiban, for sharing those two very bold pledges, not small ones. And thank you so much for UNICEF's vision and commitment. I think it's one thing that you highlighted, which I think is really important, is primary healthcare in the 21st century is changing. And I think this event highlights that and shows how we really need to start including that in the vision at large. Also, many thanks for UN agencies, governments, and private sector for playing such a critical role in scaling up these interventions. Which brings us to our next panelist, who can help us explore that intersection between humanitarian efforts and the private sector. Dr. Paul St. John Frizzoli is currently the interim lead for the LEGO Foundation's humanitarian portfolio. His expertise on play-based mental health and psychosocial support, as well as social and emotional learning, SEL, supports the programming, research, and advocacy for the LEGO Foundation and across the LEGO Group. Previously, he worked with a range of NGOs across different contexts. Paul, hello, welcome. The LEGO Foundation has heavily invested in play-based interventions to improve psychosocial well-being. You are also co-lead for the task teams on mental health, MHPSS, and social and emotional learning in the Education Alliance. Could you describe why and how LEGO has chosen to expand their work on MHPSS and social and emotional learning?
Yes, thanks, Danielle. And I've scrapped 30 seconds so we could do a little play activity. I hope you'll all bear with me and kind of channel your inner 8-year-olds. And if you're not up to it, just breathe. Okay. It's been a long day. We have all been up probably pretty early. Some people are, have traveled time zones. I'm seeing yawns in the audience. So just bear with me. We're going to do a tense and release play activity really quickly. So I'm going to ask you to just tense your hands and release. Tense your arms and release. Tense your shoulders. Release. And now you're going to tense your whole face and look so ugly, okay? Tense your face and release. And just take a couple breaths. Okay, thank you. Thank you. I still have stuff to say though. Okay. We believe at the LEGO Foundation that all children across ages and stages deserve the right to become creative, engaged, and lifelong learners who can thrive in this very constantly chaotic, changing world that we live in, and doing that through the benefits of learning through play. We know that psychosocial well-being and social emotional learning, it underpins quality education. This is especially true for refugee children, internally displaced children, and host community children. But we know that MHPSS, it's one of the most underfunded, overlooked areas within humanitarian assistance. In collaboration with other partners and with play advocates, we know that learning through play contributes to children's mental health and their psychosocial outcomes. We know that it supports children's ability to cope. It helps create a sense of normalcy. It improves emotion regulation, strengthens our social connections and bonds, and we know it promotes social emotional skills. And children's well-being across ages and stages is just necessary for optimal learning and child development. This is also true for caregivers and teachers. We know that caregivers and teachers' well-being, it's so crucial so that they can themselves thrive and also help children to thrive and develop. So we need to focus more on evidence-based MHPSS and SEL programs that include learning through play. We also need to understand what's working, for whom, under what conditions, given that this is such an underfunded area in humanitarian assistance. And with that in mind, the LEGO Foundation, we are pledging $40 million to play-based MHPSS programming and evidence generation. We want to see how we can support children to thrive, support their mental health, their social emotional well-being outcomes, and we commit to doing this in Kenya, Ethiopia, Uganda, Jordan, and Lebanon.
Thank you.
One more breath, I'm not done. Sorry. We also believe in the power of partnerships. So together with Right to Play International, with UNICEF, the International Rescue Committee, that we've brought together over 25 stakeholders to submit this joint pledge to increase focus and urgency to MHPSS and SEL in education systems. And our vision is that education systems are strengthened and adequately resourced to protect and to promote the mental health and psychosocial well-being and social emotional learning needs of all boys, all girls, teachers, including those in refugee and displacement settings. So thank you for playing with me today.
Thank you, Paul. That's a much needed play break, and I'm sure it was very much appreciated. I know it speaks to my heart. I love play-based learning. So first of all, thank you so much to the LEGO Foundation for that very generous commitment, and also for being a champion and a leader in play-based learning through the years, especially in emergency contexts. I know how committed you are to evidence and making sure that programs can be scaled effectively, but also with knowledge that they're working. And also, thank you so much for being a leader in the MHPSS SEL pledge, the task team, and bringing forth all those stakeholders to come together to form a unified vision to achieve some wonderful outcomes. And now we're going to move to a civil society perspective. Our next panelist, Claire Whitney, serves as International Medical Corps Senior Global Mental Health and Psychosocial Support Advisor. She is a licensed clinical social worker and has extensive experience supporting humanitarian MHPSS programming in diverse global emergency, post-conflict, and refugee contexts. Claire, welcome. International Medical Corps systematically builds in MHPSS within their health programs worldwide. Could you tell us how you do this and the role civil society plays in positively reinforcing MHPSS interventions, both globally and in refugee hosting countries?
Thank you so much. And it's an honor to be here today, representing both International Medical Corps, but also the wider international NGO community. As our colleagues have bravely given testimony to, in emergency settings, there's a significant toll on the mental health and psychosocial well-being of individuals, families, and communities, even if these wounds are invisible. Exposure to violence, loss, protection violations, displacement, and economic difficulties cause massive suffering and despair. And this exacerbates the needs of those with pre-existing mental health conditions and causes significant psychological and psychosocial distress for others. There's a substantial mental health treatment gap in humanitarian settings and an overburdening of the mental health care systems in such settings, and therefore access to mental health specialists can be quite difficult and limited, and medications often insufficient. We can and must make mental health care available, accessible, and affordable for those in need. International Medical Corps prioritizes MHPSS programming and integrates mental health into our health services because we know that doing so will help to expand our services and support. We follow international guidelines and global best practices of integrating mental health into general healthcare. Using the WHO UNHCR MHGAP Humanitarian Intervention Guide, a tool that guides healthcare providers in being able to assess and manage those with priority mental, neurological, and substance use conditions. This helps with the first-line management through a task shifting approach, which some colleagues have alluded to. We also use our own toolkit for the integration of mental health care into general health care, as well as scalable psychological interventions to ensure that much needed counseling and psychological support is available for those in need. International Medical Corps also works with WHO and UNHCR on organizational capacity building for mental health and health integration so that they can scale up efforts in humanitarian settings to reach those most in need. To your question, civil society plays a very important role in positively reinforcing MHPSS interventions globally to help raise awareness of mental health needs as well as available services, and to combat stigma related to mental health conditions, and to also help promote help-seeking behaviors. This includes in refugee hosting communities where it is crucial for promoting mutual respect and social cohesion. To achieve the goal of mental health and well-being for all, such mental health promotion initiatives must be supported and championed through our collective efforts. Thank you very much.
Thank you so much, Claire, and thank you for elaborating on how International Medical Court integrates mental health into the general healthcare system, but also how you collaborate with WHO and UNHCR for capacity building and toolkits and other ways that show excellent best practices. This concludes the first portion of our panel, and now we're going to move to statements from the floor. We will start with the pre-requested statements, and then we'll invite speakers from the floor if time permits. So please keep your interventions to 2 minutes so we can ensure that as many partners that want to share can have that opportunity. And so our first intervention will be from the government of Estonia, Her Excellency Minister Riisalo.
Thank you, Madam Chair. I assure the Estonian government commitment to improve the mental health and well-being of refugees. Improving mental health is one of Estonian priorities. We aim to establish a well-coordinated system of mental health services that focus on promotion, prevention, and community-based services. We have also prepared a mental health action plan and established a cross-sectoral ministerial prevention council. War refugees from Ukraine face challenges in adapting to new societies, including school and work life. Moreover, their everyday stress is amplified by the war trauma, concern about relatives who have stayed fighting or missing in Ukraine, and insecurity about the future. Estonian government has prioritized mental health services and community support to Ukrainian war refugees in all ages. We have founded mental health and community support providers bearing in mind that the most effective approach is include refugees into community activities and their mental health experts into service provision. To further strengthen the preparedness and enhance well-being of people affected by the crisis, Estonia is leading the building up of a comprehensive and cross-disciplinary mental health and psychosocial support framework, together with WHO and other international organizations. It is crucial to create and maintain a crisis network around the world. Therefore, I am honored to say that Estonia has pledged to develop a systematic and sustainable coordination of mental health and psychosocial support for all, including refugees. Thank you.
Thank you very much, Minister Riisalo. The next intervention will be from the Government of Australia. First Assistant Secretary, Mr. Andrew Kiley.
Thank you all for the opportunity to speak here today. I'm pleased to represent Australia as we pledge our ongoing support to fostering the mental health and psychosocial wellbeing of refugees and asylum seekers. There are 3 elements to our pledge. First, our partnership with the Australian Institute of Health and Welfare to analyse data on health outcomes and healthcare service use by refugees and humanitarian entrants in Australia to better understand their health status, to inform the design and delivery of healthcare and settlement services and address their unique health needs and challenges. Second, our commitment to provide health settlement support services to refugees and humanitarian entrants, including registration with Australia's Universal Healthcare Insurance Scheme post-arrival health assessments and access to physical and mental health services. And third, increased investment in Australia's internationally renowned program of assistance for survivors of torture and trauma, taking total program funding to over $230 million over 4 years from 2023-24 through to 2026-27. This will provide internationally renowned specialised trauma support and psychosocial services to support refugees with their psychological issues arising from their often traumatic experiences before arriving in Australia. Australia's pledges aim to improve mental health and psychosocial outcomes for refugees in an integrated, focused and sensitive way, offering them the opportunity to establish their lives in Australia and seek support when they need it most. Thank you.
Thank you very much, Mr. Kiley. And next will be the government of the Philippines, Honorable Mr. Raul Vasquez.
Good afternoon, ladies and gentlemen. On behalf of the Philippines, I thank you all, particularly the organizers and panelists, for this high-level event. On behalf of the Philippines, I have the honor to announce our health pledges. Number 1, ensure inclusion of persons of concern in national and local structures to facilitate their access to health. Second, continue participation in the WHO global consultations on the health of refugees and migrants, and the implementation of the 2023 Rabat Declaration. And finally, third, in relation to our Rohingya pledge, ensure the inclusion and provision of mental health and psychosocial support for Rohingya refugees and other underprivileged individuals. The Philippines values the inclusion of refugees and displaced persons in our health system, and we would continue to work internally and with partners internationally to achieve this objective. Thank you very much, and good afternoon once again.
Thank you very much, Your Honorable Mr. Vasquez. Next will be the government of the Netherlands, Ms. Pascale Grotenhuis. I hope I pronounced it correctly.
She's just coming. Thank you very much. Are you willing to take the floor now?
Yes, that's fine. Thank you very much. Hi, and I will be brief because my voice after all the talking today is actually not so good anymore. But thank you so much for organizing this. It's such an important topic. So yes, for this way, that's absolutely fine. So 16 signatories committing in actionable and measurable ways to MHPSS and inclusive humanitarian development and peace programming for and with refugees and host communities. And I think it shows a fundamental change since the first URF in 2019. Both the international community and people affected by crisis acknowledge and address mental and psychosocial issues more often and more openly. I was just talking to the WHO on the crisis in Gaza and in Ukraine. So this development, together with the ever-increasing crisis tumbling over us, leads to largely increased mental and psychosocial needs that are expressed. And we need to step up further our efforts to address these needs and to exponentially increase capacities to do so. The Kingdom of the Netherlands pledges continued engagement. Our specific commitments in this pledge are to enable organizations working with refugees and host communities to actually integrate MHPSS in their work through operational tools, including on training under the MHPSS minimum service package, and through a rapid deployment mechanism that seconds experts on integration and coordination in crisis response to cooperating humanitarian organizations. And that mechanism proves needs-driven and very effective. And I sincerely invite you to join us in increasing its scope and its capacities. You can find me if you want to.
Thank you so much, Ms. Grotenhuis, for sharing that pledge and for the Netherlands' leadership with the multi-stakeholder pledge. Next, we have the European Commission, Mr. Michael Kuhle.
Yes, sir.
Thank you very much. And thank you, Madam Chair, for giving MHPSS a voice. Because everybody who has traveled ever to a refugee camp, everybody who has ever been in a protracted crisis situation knows how important it is, how deadly MHPSS is. It's a silent disease. It's less visible than a pandemic. It's less visible than hunger, but not less tragic, as we heard from Ted and others, and not less mortal and fatal. So I'm very happy about the initiative that Mr. Arne and my Dutch colleague just made visible, where the European Union, where Germany, where the Netherlands work together and have made this pledge today, not only to commit money and make this area of work more visible, but also to get it, so to say, as a cross-cutting priority, not only in our humanitarian work, but also in our peace building and our development work, because that's what it takes. Now, if you look at the European budget, you see clearly that it is a very important area of work for what we're doing inside the European Union and internationally. Altogether, if you take all the different components of our work, the different facets of this work are being dedicated to about 1.3 billion euros. If you only look at the humanitarian aid, then it's 114 million euros that we dedicate to mental health and psychosocial support work over the couple of past years. And this is going to continue. But this will alone not do the trick. We need to do the right thing. We need to have more commitment. We need to have more visibility. We need to have more donors. And therefore, we did not only announce this pledge today, and you find it actually on the Global Refugee Forum website, we also call upon you, all of you actually, to work with us, to join the initiative, but also work with us in order to roll this out. We need to provide minimum service packages as developed by the ISC reference group for the people in need. We need to provide quality funding for this area that our partner organizations will implement. We need to use new tools, like, for example, creating hotlines for psychosocial support, including MHPSS support within safe spaces for survivors of violence, and particularly, of course, survivors of sexual and gender-based violence. And we need to have other more innovative approaches. And we need to have funding for transnational projects. And therefore, we are very happy that not only our humanitarian, but also our migration and home affairs funding is providing additional financial support for work internationally. So this is not something which we should overlook. This is central. The world is full of protracted crisis. There are many women and children that are concerned by this, and whoever of you has been in one of the camps and has seen how much children suffer from that will probably agree with everybody who speaks here. This is not something we must neglect. Thank you very much.
Thank you very much, Mr. Kohler, for the European Commission's commitment. And next, we're moving to the World Health Organization, Dr. Jerome Salomon.
Thank you, Chair. I'm Professor Jérôme Salomon, the World Health Organization Assistant Director General for Universal Health Coverage, Communicable Diseases, Non-Communicable Diseases, and Mental Health. No matter the emergency, WHO stands ready to support those affected, and this includes refugees. We have been the global leader on mental health and psychosocial support for at least 2 decades, providing direct support to countries, issuing normative guidance, and leading across agencies. We support mental health in terms of emergency preparedness, response, and recovery to build back better mental health systems, collaborating closely with UNHCR and other partners. I am pleased to announce the following World Health Organization pledge. First, WHO will develop and test a multi-sectoral mental health and psychosocial support assessment toolkit to assess needs and resources in partnership with United Nations and interagency standing committee reference group agencies. Second, WHO will be working with these partners to scale up the ISCC mental health and psychosocial support minimum service package funded by the Netherlands through capacity building in at least 5 countries with refugee populations by 2027. Third, WHO will ensure that mental health and psychosocial support is integrated in WHO's emergency responses. WHO will include it in all humanitarian needs assessment, key humanitarian planning, and monitoring documents. This includes staff with expertise supporting country-level operations in each major emergency that responds to refugees' needs. Fourth, WHO will build the capacity of humanitarian actors from at least 25 countries to respond to mental health and psychosocial needs of refugees in full-scale simulation exercises to ensure mental health and psychosocial support preparedness by the end of 2024. I thank you.
Thank you very much. And we'll be moving now to World Vision International, Ms. Lilian Dodso.
Thank you so much and good afternoon. My name is Lilian Dodzo and I'm the Regional Director for World Vision International in East Africa, here representing the Faith Action for Children on the Move Coalition, which commits to working together as faith, interfaith and non-faith actors to contribute to both multi-stakeholder child rights pledge as well as health and mental health pledge. The pledge is supported by more than 10 organizations and growing, and has the following 4 components. The first, to support roundtable discussions, policy briefs, and specific identified action in collaboration with local actors to promote and ensure faith-sensitive mental health and psychosocial support programming for refugee and host community children, ensuring meaningful participation of children and their communities. Second, to develop training and capacity sharing resources on faith-sensitive mental health and psychosocial support for faith leaders as well as mental health practitioners. Third, to support revision and update to the faith-sensitive mental health and psychosocial support guidance. And fourth, to build evidence on the effectiveness of faith-sensitive mental health and psychosocial support programming in influencing mental health and well-being outcomes for refugee and host community children. Thank you so much.
Thank you very much. Next is Brother Michael Schoff from the Jesuit Refugee Service.
I'm very honored to present the commitments of JRS, Jesuit Refugee Service, and I hope that they will increase the quality and the visibility that so many of us are aiming at. Jesuit Refugee Service is a faith-based organization. We have 2 important areas of work, education and MHPSS. And our work starts in all of those areas with the accompaniment, building a relationship with a person, a relationship of trust and understanding that takes into account all the capacities of a person. With this approach, we serve through our community-based programs. And as we walk with refugees, we are aware of the chronic stress that characterizes their daily lives and hinders their abilities to heal, to learn, and to determine their own future. In such diverse situations, like members of the Rohingya community who have been living in Indonesia on and off the street for 10 years to hope that resettlement will be a solution. In situations like a violent border between South Sudan and Sudan, where it is simply incredibly difficult to survive, and in situations where people come from Ukraine to Romania, and within a week or 2, they have to decide, how can we go on? How can we make a good decision about our lives for the homes that we need, for the food that we have to eat, and for the schools, the children that we need? How do we get into a mental space to make a good decision? Technically, JRS has played a leadership role in this area, MHPS, for quite a time. We have contributed significantly to the development of the Interagency Standing Committee guidelines for MHPSS, and we are also a member of the AISC reference group on MHPSS, as well as some working committees. Here we have signed on to 2 pledges to foster mental health and psychosocial well-being, the pledge on advancing quality MHPSS to displaced persons and host communities across the humanitarian development peace nexus, and also to this pledge on MHPSS and social and emotional learning. We want to focus on research, advocacy, and programming, especially for community-led MHPSS programs. Thank you very much.
Thank you very much. Next, we're going to move to art illusion. Dr. Max Frieder, the floor is yours.
Good afternoon, everybody. Actually inspired by what Lego did. Can everybody just shake out their hands a little bit? Can we just shake it out? Let all that stress, all that stuff that we're holding inside of us, let it all out. And let's take maybe one more deep breath and then just make a really loud out sound. So, could you maybe 2 more? Just 2 more. And one final one. Amazing. It is so wonderful to meet all of you. My name is Max Frieder. I am the co-founder and chief creative officer of Artolution. And Artolution is an international community-based public arts and education organization. So we really believe in using the arts, especially collaborative arts, as a form of promoting mental health and well-being, all led by local artists, culture makers, all with the primary goal of supporting mental health and well-being through creativity, expression, and storytelling. The fact that we're even here right now is a moment in history. The fact that the arts and culture are being valued as a part of the conversation within mental health and well-being is really the first time this has happened on a global scale like this. The fact that we've been invited to be part of this consortium has been really groundbreaking. It's been a moment for us that's completely transformed what's really possible in being able to have our teams of local refugee artists around the world being able to lead their own programs across 6 different continents across the globe. So our pledge is to be able to scale our approach, which is currently in the Rohingya refugee camps in Bangladesh, in the Syrian camps in Jordan, Lebanon, and Turkey, in the South Sudanese camps in Uganda, as well as across the Venezuelan response in Colombia, to 16 new contexts, training an additional 320 teaching artists in our methodology, being able to equip local RLOs and CBOs to be able to lead their own programming, and to be able to scale to 16 new contexts across the world, and being able to utilize this as really the next phase in the history of arts to be able to support mental health and well-being. So thank you all so much, and we deeply appreciate and are grateful for all of you. Thank you.
Thank you very much. I forgot to note that Parliamentarian Secretary of State Anand had to dash to another event, but he was most grateful for having participated. And actually next on the list is my own organization, Amal Alliance, and Vivian Shaima will be presenting our pledge.
On behalf of Amal Alliance, its partners and signatories, we pledge to prioritize the psychosocial support and well-being of children, teachers. Our goal is to reach 500,000 children from early childhood to primary and capacitate 6,000 teachers, caregivers, and social workers by 2027 in multiple countries. Amal Alliance further pledges to develop a tool to support and recovery the psychosocial needs of children and caregivers experiencing grief and loss following the onset and the crisis. Thank you.
Thank you very much. And next we have Right to Play International, Susan McIsaac.
Thank you. Psychosocial well-being underpins the quality of education for all children, but is especially true for refugee, internally displaced, and host community children who are disproportionately impacted by conflict and crisis. Recognizing the right of a safe and playful childhood, Right to Play International pledges to work with national and local partners to deliver culturally and context-specific play-based PSS approaches to enhance the quality of teaching in safe and supportive environments, improve learning outcomes, and support children's psychosocial well-being, with a focus on children in low and middle-income countries, particularly refugee, internally displaced, and host community children. This is embedded in our new global strategic plan, which I hope my board will approve on Monday, and we will launch in January of 2024. Thank you.
Thank you very much. Next is Save the Children. Naya.
Thank you all. I'm happy to be here, and I'd like to introduce myself. My name is Naya. I am 16 years old, and I am a youth ambassador for Save the Children in the Netherlands. I'm actually one of the only children at this whole event. So when I was 7 years old, I fled my home country, Syria, and I found refuge in the Netherlands. When I got to the Netherlands, I suffered a lot mentally, and I remember it very well, and it was very hard for me to move on with my days. This is why I'm very happy about the consultation Save the Children did with over 300 children globally, and they all expressed the same needs as me. All the children expressed this important need. The important need is to feel psychological and physical safety. I remember it very well. When I was a child, I used to always feel like maybe the war could be in the Netherlands. Maybe it's going to continue here. Maybe they're after me. Maybe it's not finished after all. It's how a children views the world, how a child views the world. I didn't know the political situation. I was used to the war. I was used to seeing all the terrible and dangerous things I saw on a daily basis in the streets. I saw people losing their lives. I thought that was going to continue in the Netherlands. So this is how we look at our world. And that's why I and Save the Children think that there should be a support system for children to be protected mentally. Save the Children pledges to invest in MHPSS knowledge to make sure that we, children with a refugee background, get treated with care, dignity, and respect. Thank you.
Thank you so much. And I believe there's time for some interventions from the floor. So if anybody would like, please go ahead. And please introduce yourself as well.
So, hello, good afternoon. My name is Nicolas. I'm representing the government of Austria. And I thank you so much for organizing this event, dedicated spotlight session on health and MHPSS. Let me introduce also the intersectional dimension of health and gender. So we are announcing a pledge that's called Restruff, Relief, Recovery and Resilience, Strengthening through Protection and Health Services in Jordan, with 1 million euros that will be implemented by Caritas Austria and Caritas Jordan, two civil society organizations that aims particularly at providing protection counseling services to refugees that meet their gender-specific health needs, with a strong focus on provision of primary and secondary healthcare services and referral to external service providers, with 5,850 targeted beneficiaries. A second pledge that concerns our contribution to UNFPA's activities in Ukraine and Moldova, with 2 million euros that is specifically targeted towards training of healthcare providers on improving quality of emergency, obstetric and gynecological care for women and girls from refugee and host communities. Targeted beneficiaries, more than 19,000 persons. Another of our projects concerns the Center for Health and Migration, Good Migration Governance and Health in Uganda and the region East Africa too, that concerns further development of the course program on health and migration, deepening cooperation with existing partners by involving other relevant stakeholders, international organizations, NGOs and local and regional actors, and knowledge regeneration in the local health sector. And finally, and it pleases me particularly to announce this in a room where we also have the Deputy Executive Director of UNICEF on the panel, our contribution to the UNICEF Ukraine and Moldova program for 2023 and 2024 in the amount of 4 million euros, with a specific focus on provision of mental health and psychosocial support and response services, and provision of comprehensive medical and legal services for survivors of GBV. Thank you so much.
Thank you so much for sharing the commitments of the government of Austria. And would anyone else like to take the floor?
Right. Good evening, everyone. My name is Mohammed Al-Hajali. I'm academic clinician. I'm chairman of Syrian Watch Society, which is refugees, civil society, and community-based organization. So I would like to announce today that on the 7th of December, we signed as Syrian Watch Society a pledge which is end the stigma around mental health and psychological support in Wales, joining a campaign called Time to Change Wales. In addition to this one, through lobbying with members of the Welsh Parliament, we agreed with them, and we had an agreement last week that there will be debate around the adoption of this international pledge to be adopted in Wales. And that's the first time ever community-based organization championing for international pledge around refugees to carry that one to the Welsh Parliament and to have a debate on that one. Hopefully there will be a vote on that one and that will be adopted and taken to the Welsh Parliament. So this is an exercise for us as refugees and as community-based organizations, how we translate an international pledge into reality, into national politics as well. Thank you all.
Thank you very much. Would anyone else like to take the floor? I see a hand in the back.
Thank you. My name is David Keegan. I'm from the Asia Pacific Refugee Rights Network. Today we've heard that there are 114 million displaced people internationally. And I wanted to highlight that many of those refugees will end up being stuck in between countries, seeking asylum, and won't actually end up being able to get to protection countries. And in Asia Pacific, many of the refugees are living in urban contexts with actually no access to basic health services. And so I guess I really appreciate the pledges and the contributions today, but I also want to draw attention to the need for services like Mr. David has outlined today, where refugees are supported to be able to deliver peer-based support programs to support the basic needs of people's survival in places where they have long-term uncertainty about their future and where they're experiencing secondary trauma after having fled places where they come from. And so I guess, and also in Asia Pacific, there needs to be more investment to support communities where there are no basic access to clinical support services. And so I just wanted to draw attention to the need for that broader psychosocial support, particularly for refugees and by refugees in communities where access to health services are limited. Thanks.
Thank you very much. Just to make sure we're on time, before I wrap it up and send it over to our Master of Ceremonies, I just want to thank all the governments, INGOs, NGOs for your very generous commitment and vision to really fostering mental health and psychosocial support. And I just want to make a few highlights from what we heard today. We've seen a fundamental change from the first GRF, where we are now seeing MHPSS on the forefront of the main agenda, but there is still a lot of work to be done. But we can achieve this together with all of our different efforts. Mental health is still underfunded and overlooked, but if we work with community-based organizations, with refugee-led organizations, leverage that local capacity and empower individuals to really leverage the skills that refugees bring to the communities that they come to, we can really make a difference in mental health and psychosocial support moving forward. And on that note, I will pass it off to Ariane. And thank you so much for all of those who shared their personal stories. Very inspiring and very moving.
I've remembered to switch on the mic this time. Thank you so much, esteemed moderator Danielle and esteemed panelists, experts, for your contributions. I'm sorry, because of time, I cannot mention each one of you separately. I would love to, and everyone for your contributions from the floor. I've been hugely inspired. And thank you to Lego and Articulation for the exercises, the breathing exercises, much needed. And I think it brings me to an important point very briefly, is that your mental health matters too. The mental health of humanitarians on the front line is hugely important. We're exposed to so many traumas repeatedly. If anybody wants to collaborate, connect, I would love to get in touch and for you to get in touch with us through our Wellbeing. I would like to summarize the event now. It's a big task, but I would like to say that more people than ever are being forcibly displaced. They don't have adequate and equitable access to physical health, mental health, and psychosocial support mechanism, we've heard, or the barriers and the factors affecting them. And that brings me to the point that your work is highlighted in such an importance. And it also highlights how much more work that needs to be done. But the final point is that we shouldn't lose hope in the face of the enormity of the challenges. Sometimes when I get frustrated, when I get tired from whatever I'm doing or the little contribution that I do, I remember one image of a child refugee that I visited a few years back in Kabul, Afghanistan, when I went back. We had a moment together, and when I was looking into her eyes, my own childhood flashed in front of me. And that reminds me that if I could rise from a position where she was, and I've heard from children refugees and others who've told their stories, if they could rise from that position to be where they are to contribute to society, what could millions of other refugees across the globe do if we come together, extend our hands in solidarity to support them? I believe together we can save countless lives, transform many futures if we work and collaborate. And we can also promote peace. I believe that the session doesn't need any more addition from me or from anyone else. The solidarity is the theme for all of us. The event was prepared by the Group of Friends for Health in two work streams, Health and MHPSS. The leadership of the work streams are shown on the slide. This is not the end of the work of the Group of Friends. Early next year, a meeting will be held to discuss how we can capitalize on the important achievements of the last months. It's important to keep the momentum, to strengthen equitable services for health and MHPSS for refugees and host communities. I would like to remind you that there is a photo opportunity for all members of the multi-stakeholder pledges, health and MHPSS today in about 30 minutes. That is outside the media room 3, up the ramp from the main plenary room. I'll be looking for it. On behalf of the leadership, stakeholders, and forcibly displaced people around the globe, I sincerely thank you, each one of you, for your contributions, for your attendance, for listening, and for your pledges to do more. Thank you so much.